I'm Dr. Kenneth Levine. Thank you for coming back to Health Talk. Again, we're streaming live on the web at www.tvchannel19.com, and you can see us on all your iPhones, iPads, all your electronic devices. I'm here tonight with a very special lady. She is part of a team of women that I work with, and we treat very special people. We treat infants. Now, Cindy O'Brien is here. We do a lot of work together. Cindy is a lactation consultant at Plantation General Hospital. I want to talk a little bit, Cindy, about what my experience is, but give us a little introduction as to how you became a lactation consultant.
Well, I was a registered nurse, and most of my career has been in the field of maternal child nursing. And I really felt that we needed to promote breastfeeding because of the health benefits, but we really had very little support for our mothers. So 15 years ago, I wrote a proposal to the hospital to start a lactation program, and that's what I've been doing since then.
Do you find, well, I think, is breastfeeding more popular now than it's been in the past, or less popular?
We probably, South Florida has, well, let me back up. Broward County has an initiation rate of about 80% of all mothers beginning to breastfeed. Unfortunately, the rate of exclusive breastfeeding by 3 months has dropped down to about 30%. So it's showing that we need to have ongoing support for these mothers, because the American Academy of Pediatrics, their recommendation is that all babies would receive exclusive breast milk for 6 months and then continue receiving breast milk for 12 months, and as long after that is mutual beneficial to both mom and babies. Actually, the average weaning age around the world is 4.
Really?
And you have to think that in some of the undeveloped countries that don't have clean water, don't have, formula, ways to wash their bottles, it's the babies, the young children that are being breastfed that have survival rates much higher than those that are not.
Well, that makes sense. There's also, isn't there a bank, the liquid gold of breast milk that people are banking?
Yes, there are breast milk banks, which basically mothers are screened before the milk is pasteurized, and then human milk is provided. It's fairly expensive, but for some of our preterm babies, that is absolutely invaluable. So it is a way to promote the health of these very preterm babies too.
So a mom, especially a first-time mom, gives birth to a baby. When do you as a lactation consultant get involved?
At Plantation, we see all of our mothers every single day that they're a patient in the hospital.
How would a mother know that she has a problem and their baby might need to see me, for instance?
Well, one thing that we identify when you and I work together basically is pain. Mothers, even though they correct the latch, they think the baby's on there properly, mothers are still in pain, and breastfeeding should not be painful. And you also would maybe see a baby that is breastfeeding all the time but really not gaining weight.
Right.
So that's kind of a red flag.
You know, there's a popular TV show called Royal Pains. It's about a concierge doctor in the Hamptons on Long Island, and they had this very rich family who had a very rich baby that was losing weight, and they were going to send this baby for CT scans and MRIs, and this genius doctor comes out, looks at the baby, puts his hand in the baby's mouth and says, you know what, this baby's tongue-tied, all we have to do is release it. We'll be back in a moment, and we're going to talk more about tongue-tie releases and breastfeeding. Again, I'm Dr. Kenneth Levine with Health Talk. We'll see you in just a moment. Thank you.
Your body first begins making milk, called lactation, during pregnancy. When your baby is born, your breasts will already be making a thick, very nutritious milk called colostrum. Over the next several days, colostrum will give way to mature milk, which is thinner, more plentiful, and just as nourishing for your baby. This amazing food can only be made by your body.